MRI shows a massive retracted rotator cuff tear. For this, we will use a bovine patch to augment the repair. It is secured by several bioabsorbable tacks inserted all arthroscopically through the lateral portal. This augments a poorly vascularized cuff. This is a massive tear seen here with a crisscross repair to be augmented. The patient will be able to go home and has had a minimal pain, if any, and he is a prominent orthopedic surgeon himself who sent me this video 5 weeks after his own surgery. The pads for neurotherapy on his right shoulder to augment the blood supply and avoid atrophy. You can see this excellent result only 5 weeks, where he told me he did not take a single pain pill. Rotator cuff repairs do not have to be painful. This is a great result.